Thanks, Simon. This will be even briefer. So the original venous leg ulcer guidelines were published in 2011, and these were developed by the Australian Wound Management Association and the New Zealand Wound Care Society and approved by the NHMRC and the New Zealand Guideline Group. So the role now is to review that guideline and make evidence-based recommendations for the prevention and management of venous leg ulcers. So currently it involves a critical appraisal of the evidence, communication of opinion from experts with varying experiences, negotiation to achieve consensus, and then voting on all the recommendations with a grading and then looking at dissenting opinion. So there are a number of multidisciplinary teams, and they're created from nurse practitioners, vascular surgeons, there's one geriatrician, general practitioners, registered nurses and allied health professionals and consumer groups. So the guideline development group is made up of elected members from Wounds Australia, the New Zealand Wound Care Society, Hong Kong Group, and the Wound Healing Society in Singapore. So sitting beneath the guideline development group is a methodologist, Emily Hessler, who's based in Canberra, and then she helps communicate basically between the development group and then the small working groups, of which there are 22. And I'm in one of those groups. I'm in the surgical group. So there are 50 participants, and they're from Australia, New Zealand, Hong Kong, and Singapore. Having a look at this list is quite interesting. You can see there's quite an industry that's developed around venous leg ulcers, of which surgery is one of these groups. Now, traditionally, leg ulcers have been in the domain of nursing staff looking after compression and wounds. And I think there's a big paradigm shift that should be happening, and I think is happening. So the topics that we have to cover is primary prevention, management of venous leg ulcers in the community, secondary prevention, special populations such as the bariatric and Indigenous, and then looking at guideline implementation. So this is a time frame. It started in the middle of last year. Emily did all the literature gathering. There's currently underway is the critical appraisal and data extraction, which we're doing. And I must say, the calibre of the research that I've been reviewing is not good. And actually, in preparation for the talks today, I've actually forwarded her a number of excellent studies that haven't been included. So that critical appraisal hopefully is going to finish in the next 4 weeks. We're then going to revise the current guideline. We then apply NHMRC grading, which is really done by the methodologist. Then we put it to the consumer, public consultation, there's an NHMRC review process, and then the guidelines should be launched in the middle of next year. So having a look at this group, every single person in the guideline development group is a nurse, except for one person who's a geriatrician. Now again, I think this reflects the domain of leg ulcer management for the last 100 years, but it's not necessarily up with the current paradigm. So I think there is a paradigm shift happening in ulcer management. It's slow. I think aiming for cure and long-term prevention is possible when you address the root cause and you do surveillance. We have a big challenge as surgeons because we have to have a more hands-on approach, and we have to have a commitment to venous intervention and surveillance with an active contribution to these guidelines and communication with our colleagues. So if you're interested in participating or just giving an opinion, Emily Hessler, the methodologist in Canberra, is the one to contact. If you'd like to jump in now and assist with the guideline development, then Judith Barker is the chair. So Emily sent me this response when I sent her my presentation. She was really pleased that I was introducing these guidelines today. And I don't know if this was an autocorrect or if she was just trying to be funny. But any contribution would be much appreciated. Thank you.